Hello friends, welcome to the channel Pathology Riddles. Today we are going to give you a case-based scenario. Try to guess the answer. Look out for nice images which we have captured. Now meet Amy, an 8-year-old girl. Amy's mother noticed that Amy is getting generalized swelling of the body, also called anasarca. Now this swelling was more towards her face and her feet. There was periorbital edema, and the edema was of pitting type. Her urine analysis showed protein of 500 milligram per deciliter. So the question for you all is, how do you detect protein in urine, also called proteinuria? The answer is heat and acetic acid test, sulfosalicylic acid test, and dipstick test. A routine microscopy of urine was also ordered for Amy. This is the microscopy image. Now this is a wet mount, unstained obviously. Can you identify the structures? So there are oval fat bodies and fatty casts. What are oval fat bodies? These are actually degenerated renal tubular epithelial cells, which are filled with cholesterol droplets. If you manage to find a polarized light, you can see the characteristic Maltese cross pattern. They can also be stained with Sudan 3 or oil red O. What are fatty casts? Fatty casts are actually cylindrical structures which have triglyceride and cholesterol in a Tam-Hos-filled protein matrix. Whatever cylindrical structure we find in urine is always considered as cast because it has taken that tubular shape of the tubules. So what is your diagnosis? As most of you might already have deduced, it is a case of nephrotic syndrome. So what is this nephrotic syndrome? Nephrotic syndrome is actually a derangement in glomerular capillary wall, which will lead to increased leakage of your plasma protein. Now this leakage can be of two types, highly selective one or a poorly selective proteinuria. Now highly selective proteinuria only leaks out low molecular weight proteins. Poorly selective, as the name suggests, it doesn't care about molecular weight. So high molecular weight as well as low molecular weight proteins are excreted out. So how do you diagnose nephrotic syndrome? There is massive proteinuria, that is more than 3.5 gram per day of excretion of protein via your urine. Now how do you detect it? You can do a 24-hour urinary protein. This will lead to hypoalbuminemia because as you are excreting a lot of protein, so the protein levels in your serum will decrease. It will be less than 3 gram per deciliter. Now what will all these lead to? It will lead to generalized edema. Why do you get generalized edema? Because there is sodium and water retention along with your decreased osmotic pressure. All this and hyperlipidemia. Now the causes of this hyperlipidemia have not been actually characterized. It is a combination of increase in lipid production as well as decrease in lipid catabolism. What will this lead to? This will lead to lipiduria. So the lipids will start uh, coming out in the urine. So what will the tubular epithelial cells try to do? It will try to absorb it and keep it. But these tubular epithelial cells are also sloughed off. Now once it is sloughed off, it will present in the urine as oval fat bodies and fatty casts.
This was an attempt to make a clinical case scenario to help you understand cases. The level of riddles were kept easy for the students. Please share and comment if you want this kind of videos. Do subscribe and like this video if you found it useful. Thank you. Bye.